Chronic pain is one of the most common concerns in our primary care practices. Yet most of us feel frustrated and dissatisfied with our ability to manage patients with chronic pain, especially when it comes to prescribing and using opioids. Our patients aren't happy either. As clinicians, we may feel trapped in a kind of tug of war with our patients, where it seems like we are competitors rather than teammates, and there never seems to be a shared victory.
Or we may feel like police officers rather than healers.
When we discuss cases with our colleagues, we often refer to them as our chronic pain patients, and sometimes have a hard time seeing beyond this diagnosis or focusing on much else during the visit. We often wonder if we are even helping improve our patients' lives. Sometimes we wonder if they may be addicted or selling their opioids rather than taking them.
Some of us dislike the idea of prescribing opioids for pain and refuse to do so. Or we may simply wish to stop prescribing opioids but don't feel we have that option.
Maybe we can't stop because we work in a clinical culture where liberal prescribing is the MO, and going against the grain would be difficult.
Or we've inherited patients who've been on opioids for years and years, and the thought of changing their treatment seems untenable, so we continue to begrudgingly prescribe.
Patients with chronic pain also are dissatisfied. They are scared their pain will not be controlled. Some even feel they have to exaggerate their symptoms, rating their pain a 13 out of 10, or create a good story to convince us they need their pain medications. Others may not even want to be on opioids. They actually find the side effects too limiting to let them lead their lives pain-free, while still being engaged in what's important to them, but they don't see any other alternative.
They often feel disrespected and distrusted, labeled as drug-seeking. They may feel their symptoms are dismissed by their clinician as being trivial and not warranting medical care. In some cases, they feel their character or honesty is being questioned.